Polk County's Health and Human Services Division is made up of many important components, and one of them is community healthcare, led by Joy Johnson. This section works to administer health coverage and remove barriers to accessing quality healthcare for Polk County's medically underserved residents. Welcome to the Commissioner's Report. I'm Miles Vance. Today, I'm joined by Joy Johnson and County Commissioner Mike Scott. Welcome to the show.
Thank you. Appreciate it.
Thank you.
So, Ms. Johnson, I'd like to start with you. Tell us about community healthcare. What is it? What does it do?
So community healthcare is an umbrella that pulls in all the different moving pieces of healthcare services and outreach in the community. The biggest being the Polk Healthcare Plan, which is funded by the voter-approved half-cent sales surtax. But not only do our services not limited there, but we also carry out other functions that relate to healthcare mandates. We have other contracts, other grant activities, but really reaching out to the community under that umbrella helps us to have more reach countywide.
Absolutely. Commissioner Scott, how does the community healthcare program and their mission align with the board's views and goals for the county?
Sure. So I think the primary goal of the Board of County Commissioners is to represent the residents of the county. And by doing that, you have to look at the all-inclusive services that are required. You know, often we think about things like stormwater management or trash pickup. Those are great, but those are more functional things that are, albeit kind of property-based. We look at the human side of things. You know, healthcare is really our primary objective, and by having that as a county, to me, and having a very extensive program that provides a number of different services, really gives all residents access to healthcare. It's just our job to make sure they know about it and know how to obtain it.
Absolutely. So, Ms. Johnson, I'd like to talk about the Polk Healthcare Plan.
Yes.
Can you tell us, who qualifies for this? Who's receiving healthcare through this, and how does it serve the community?
So the Polk Healthcare Plan serves our most medically vulnerable population, who are low income and uninsured. If someone qualifies for Medicaid, they would not be a Polk Healthcare Plan member. So generally they are at or less than 200% of the federal poverty level. They are uninsured. They are a Polk County resident with a valid Social Security card, because we are ensuring that they are legitimate residents of Polk County benefiting from these sales tax dollars. So we have a team of case managers that will run their information and do the eligibility determination. And if they're deemed as a member, they will have access to a plethora of healthcare services. It's very comprehensive. We offer primary care coverage, specialty care coverage, that includes behavioral health and a slew of different specialty areas. We also offer hospital services, so we'll reimburse providers for inpatient, outpatient, emergency room services. We have a formulary where members can access medications. We also get them connected to labs, diagnostics, x-rays, and things of that nature. I will say that the specialty care network is really a huge gem in this plan, because oftentimes people can get access to primary care, but it's the follow-up care for that continuity of care that a lot of people might need if they have chronic health conditions, or if they've gone for a long period of time without their health care needs being met. If they don't have access to specialty care, then their conditions can worsen. So having access to the specialists that are willing to contract with us in our network is a huge, huge bonus for people in our community.
Let's talk about that, the providers of this. When you combine the specialty care and all the other providers, there's almost 1,000 or over 1,000, I think, individual providers for people who are on this plan. Obviously, we have great medical resources here in Polk County. Talk about providing the best possible quality of healthcare to these individuals.
Yeah, so for our providers that we work with, we credential them, so they're credentialed. We determine what hospital access that they have, but it could include the actual medical doctor, it could include the physician's assistant, the APRN, and the other support services for that provider group. So they can access and really get connected to whatever their needs are, depending on how that provider group is structured and wants to serve our members. I would say that we also have behavioral health is a recent add-on to our network. Before we added behavioral health to the Polk Health Care Plan, we would have special arrangements outside of the plan network, but now we've brought it in to streamline the process of how they can go and see and get connected to a behavioral health professional. And recently, with all the news and all of the information out there about the huge need for more behavioral health access, we thought it was a critical time to really get in front of that and make sure that we could streamline as much as we can to offer as much behavioral health access to our residents.
And that's something that's so important, because health is not just about the health of the body, it's the whole being, right?
Exactly.
Yeah. Well, how many people are on the Polk Health Care Plan? Can you tell us that?
Yeah, so the way we structure the plan is to plan to have an average of 5,500 plan members on this program each month. Now, that doesn't mean that we're going to have 5,500 at the end of the year, because there could be people coming on the program, moving into the county, getting their incomes cut or losing a job, or there could be people getting off of the program because they are relocating outside of the county, or they've got an increase in pay that moves them outside of the eligibility criteria. So the socioeconomic factors is what really drives people getting in and off of the plan, with what's going on in their personal living situations and their income as well. So with an average of 5,500, we typically budget based on that, but in any year's given time, we could have 7,000, 8,000 people served through this program, just through the Polk Health Care Plan alone, accessing all of those services that I just mentioned.
Commissioner Scott, we mentioned briefly about how this program is funded through the half-cent sales tax, but I want to talk a little bit about growth, because that's obviously a topic we talk about a lot and we think about a lot in the context of what funds are available to the county, what services are available to the residents of the county. Talk about how you on the board make growth work for the residents of the county.
Sure. So I think growth certainly is a complicated equation. Growth in nature is fairly simple. It's additive, meaning we have residents or businesses or both that move into the county, which is great for a lot of areas of the county. We do have to look at where the stresses lie on different resources. And so when we look at healthcare, obviously, again, a primary focus of having a healthy population set within the county, for us, we have to make sure, and to Joy's point, these healthcare providers that are offering the services are key to the success, not only of the program, but of us as a county. Because truly, if we just have a program, that's kind of the structure of the walls of a building, but it has no people inside of it. So if we just provide a building to provide health care, but there's really no people inside to do that, then we have nothing. Mm-hmm. And so for me, it was really telling. There's a kind of a hub and spoke model that she showed as a diagram, and you see all these different specialists that we now have within this program. To me, it was so enlightening to know that even though, from an income perspective, there's challenges for this person or this family, but we have a program that helps them, but they're not sacrificing or getting a lesser level of care because of it. We are really able to provide what I would consider comparable care for their needs, whether it's on the primary care or the specialist, and it's a program that the county, fully funds. And the other part too about it being a sales tax based funded program is, all the visitors that come in, anybody that purchases products within the county truly is helping our county. So it's not the burden of just the residents. It's all of our, all of our visitors, our tourists, anybody that's here in the county. So to me, that just makes it a great community involvement to be helping for such a great program.
Right, and to your point, the voters have elected to put this tax on the sales tax because it's something that everybody believes in, helping your neighbor and having that highest possible quality of care. One thing that you mentioned that I want to talk a little bit more is the personnel and making sure that we have the best providers on the individual level. And one way we're doing that is through a partnership with Travis Technical College. Ms. Johnson, could you talk a little bit about that partnership?
Yes, we are excited to partner with the school district for the Travis Technical College. They have a dental assisting program there, and we have been partnering with them for a number of years now because while they're bringing in students to train them to become a dental assistant in our community, and data shows that we are always in a shortage of dentists and dental professionals, including assistants. So here in Polk County, we're investing in building that healthcare infrastructure for the human capital side of it. So while they're coming in and learning the first few months of that program, the basics of it, once they become chairside assistants in that program and start working on clients and assisting the dentist that's there to work on those clients, we're funding their operations. We're funding salaries of any personnel related to operating that program, because the benefit is it is another access point for our target population to access dental and to get their dental needs met. So while we're investing in the healthcare, the operations of that program, we're supporting the workforce pipeline, but at the same time we're able to get access to our target population to also get their dental needs met. So it is a win-win, and we've expanded on that from time to time throughout the years, and we are happy to fund a program that shows outcomes and success, and to be able to help people meet their needs, because oftentimes it's hard to get a job if you've got diseases and conditions with your teeth that prevent you from working with the public, or from feeling confident enough to even go out and work with the public or seek jobs. So we're wanting to help people in their physical capacity, their mental capacity, their emotional capacity, and we're very excited to support that program.
And Commissioner Scott, what a great example, right, of a partnership on that local government level, and getting people educated while helping people with healthcare, right?
Yeah, I mean, I look at it as, look at it, really anything equation-wise, inputs and outputs. Yeah. In that particular setup, we are able to provide the training opportunities for the next generation of, dental assistants, and then to provide, again, a high level of care for those that are needing dental work, to provide either just general health, or if they, as Joy had mentioned, about the confidence to go out and apply for a job, or to even work with those. And I think you also find a very common trait is that those that go through that program have a sense of not only gratitude and indebtedness, but are just certainly happy to be a part of it. And to me, that just builds a better and stronger community, which at the end of the day, that's what it's all about.
Absolutely. One of the last things I want to focus on here is access points. Ms. Johnson, you talked about having a plentiful number of access points for our residents, 301 throughout the county, including 73 in District 5. And one of those access points is mobile. Let's talk about that.
Yes, so we do have a mobile unit. In fact, our prior mobile unit had been decommissioned, and we have a new one that's just recently been delivered last week, and we are very excited about it because we want to expand the level of healthcare interventions we are coordinating out into the community with the public. So we have case managers that accompany that mobile unit as we go out into the community to try to help people determine if they don't have health coverage, how can we help them get connected to those health services that they need, whether it's Medicaid, whether it's other types of Medicare coverage, or if they don't have anything, we're trying to get them connected with a Polk healthcare plan. So we have team members that are on that mobile unit that can help people wherever we go. In addition to that, we also partner with the Florida Department of Health here in Polk County, and they have a registered nurse that accompanies our mobile unit as well, to also try to engage with the population to do some basic health screenings. So not only are we trying to get them qualified for a health care program or health coverage, we want them to engage in their own health care. And we're talking about, blood pressure screenings, blood sugar checks, cholesterol, those are things that we want to further expand and do more with getting more healthcare services on that mobile unit. So we're currently working with the health department to figure out how that will look and how we can coordinate those efforts to offer even more when we go out.
Commissioner Scott, I'd like to finish with you. What are your goals and your hopes for community health care in Polk County moving forward?
So it's going to sound simple, but I think let Joy keep doing more of what Joy does, because truly her entire team does such a phenomenal job of just talking about the mobile unit. We're not going out and just seeing who needs help, and it can only help them if they qualify for the program. We're offering these different services of just educating them about what options there are. So if they don't qualify for our program, but they are, Medicare, Medicaid, whatever the alternate may be for them, oftentimes it's just not knowing. And so the more we can do, and despite, I think, as society moves, one would think you could go onto your phone and access anything you ever need, but the reality is not everyone has a phone, not everyone has the internet. So to make that assumption, I think, would be very blind as a county. So for us, having a mobile unit, having boots on the ground, people talking to people makes the community better. And
Absolutely.
So that I am super proud to be a part of the county, super thankful for the entire organization of what they do in healthcare, and I really look more forward to her expertise, her team, because I'm never disappointed and really get excited the more they bring to the board.
Absolutely. Well, Commissioner Scott, Ms. Johnson, thank you so much for joining me today.
Absolutely. Thank you for having us.
Thank you.
And I'd like to thank you for joining us. To learn more about the Polk Healthcare Plan and to apply for coverage, visit www.polkhealthcareplan.net.